Breaking news. NHS GP rule changes are now live. If you're a UK senior, you must act fast to avoid being left behind in the healthcare system. These changes, effective May 2025, are set to overhaul how GP services operate across the country. For seniors aged 60 and above, this is a critical moment. The familiar processes, frustrating as they may have been, are being replaced with a digitized system that prioritizes efficiency and accessibility, but only for those ready to adapt. If you're not prepared, you risk losing access to the care you rely on. Gone are the mornings spent desperately dialing your GP at 8 a.m., hoping to secure one of the limited appointment slots. The NHS is replacing this outdated scramble with a 24/7 online booking system. Patients can now book appointments at any time of day, spreading demand throughout the day and reducing chaos. However, this shift to digital-first services could alienate seniors who lack confidence with technology. While the NHS has promised to maintain offline options like phone bookings and in-person visits, the pressure is on older patients to adapt quickly or risk falling through the cracks. Referrals to specialists are also undergoing a massive overhaul. Under the old system, you'd wait weeks, if not months, for a consultant referral. Now, GPs are being urged to consult with hospital specialists digitally before making a formal referral. This could potentially save time by resolving issues within primary care. However, critics fear it could lead to under-referrals or misdiagnoses, especially for complex cases. The NHS insists this streamlined collaboration will improve care outcomes, but the jury is still out. For seniors with chronic or complicated health conditions, this change could either be a welcome relief or a dangerous gamble. On the positive side, the NHS is making significant investments in GP practices. Over 1,000 surgeries have received funding to expand facilities, hire additional staff, and increase capacity. For patients, this could mean shorter waiting times, more appointments, and longer consultations. Seniors, in particular, stand to benefit, as many struggle to address their multiple health concerns within the standard 10-minute appointment window. These reforms suggest a move toward more compassionate, patient-focused care, which has been long overdue. Continuity of care is also being prioritized. Practices are now encouraged to let patients consistently see the same doctor. For seniors, this is a game changer. Building trust with one GP over time is not just convenient, it's crucial. Repeatedly explaining your medical history to new doctors increases the risk of errors and adds unnecessary stress. By restoring continuity, the NHS aims to rebuild trust and prevent avoidable complications. Another major shift is in how care is delivered outside GP surgeries. Recognizing that not all patients can easily travel, the NHS is expanding home visits, local outreach programs, and video consultations. For seniors with mobility issues or those in rural areas, these options could be life-changing. Being able to consult with your doctor from home, not just over the phone but via secure video, reduces the physical and emotional strain of traveling to appointments. However, the digital-first approach still raises concerns about accessibility for those without internet or digital literacy. Ensuring these patients are not sidelined will be a critical test for the NHS. Skepticism around the reforms remains, particularly regarding whether the promised funding is sufficient to address long-standing issues in the system. Many worry that the pressure on GPS to avoid hospital referrals could compromise care for those with serious conditions. Burnout among healthcare workers is another concern. For these changes to succeed, the well-being of doctors, nurses, and administrative staff must also be prioritized. If the workforce is overstretched and unsupported, even the best policies will fail to deliver meaningful improvements. The NHS has set an ambitious target, 8 million additional GP appointments annually. If achieved, this could be a turning point for a system that has long struggled to meet patient demand. The goal isn't just to clear backlogs, it's to redefine access to care. Same-day slots, extended hours, and rapid follow-ups could become the norm, marking the beginning of a more responsive and patient-centered era in general practice. But all the investment in technology, infrastructure, and staffing means nothing if it doesn't translate into real benefits for patients. Seniors, in particular, shouldn't have to fight for appointments or feel like their age makes them a burden. Timely, respectful, high-quality care is a right, not a privilege. That's why it's crucial for patients to stay informed and proactive. If you or a loved one is 60 or older, start by asking your GP surgery a few key questions. Are they offering online booking? Can you still speak to someone if you're not comfortable with technology? Will you be able to see the same doctor consistently? How will your care change under these reforms? The answers to these questions will help you navigate the new system with confidence. Ultimately, this isn't just a moment of change, it's a test of resilience for the NHS and its patients. Some of these reforms will work well, while others may need significant adjustments. Public scrutiny will be essential. Seniors, in particular, must make their voices heard by participating in surveys, attending local health board meetings, and sharing feedback with GP practices. If the system isn't serving you, say so. Change won't happen if the people most affected remain silent. The NHS is evolving, but the road ahead is uncertain. As these changes roll out, staying informed and engaged will be your most powerful tools. Don't wait passively for the system to adapt to you. Take charge of your healthcare